baby to the child. So especially during the pregnancy, we need to be aware. Okay, let's go through the options individually. A correct? Yes. The sun kiss the sky. A is correct. Okay, because we need hospitalization. Pyelonephritis in the pregnancy is serious condition. Okay, so you need hospitalization for that one. Alrighty. Um, what about B? Avoid imaging in pregnancy. Do we need to avoid? Can we do the ultrasound during pregnancy? So this is the keyword. I know because they say imaging, but this is the keyword. Okay, imaging. But this is the keyword. Okay, imaging. Okay, guys. Sorry, got the urgent call. Uh, hello, everyone. I'm back. Hi, JJ. Sorry, guys. Yeah. Okay, let's go to question number 31 again. So, a pregnant patient at 24 weeks has pyelonephritis. Which interventions are appropriate? Select all that apply. Hospitalization, definitely, we're gonna do that. What about avoid imaging in pregnancy? Likewise, I was saying, so we can do some ultrasound, and when it's written here imaging, it can be anything, so that's why it will be correct. Okay, explain pyelonephritis. What is pyelonephritis, guys? Anyone? Otherwise I will jump in. Pyelonephritis, it is when it is tis, it is inflammation. Okay, when it is tis, it is always inflammation. What it is? Urinary kidney infection. Hanan, you will be fine. I actually heard from a couple of our viewers that they did great. So that's alrighty. You will be fine. If it is shut off at 85, there is I'm feeling like you already passed. Okay, so don't worry. Be positive. Okay, so pyelonephritis, it is kidney infection. Okay, just common, simple, and it can be after UTI. So it can affect one kidney, it can affect both kidney, it can, how infection can move from urethra to upward to kidney, so that can happen. Yeah, or it can come from the blood also. So yeah, thank you, Hanan, I really appreciate. um Alrighty. So aggressive, there are multiple cause of pyelonephritis. Like if there's somebody is having kidney stone and that's gonna block the urine, there is more chances of infection. So anything kidney infection. Alrighty. Aggressive hydration, is it gonna help? This was wrong because we were discussing like we are gonna do the imaging. Okay. Oh my god. Excessive hydration, yes. Yeah, because it is It is one of the crucial steps. We need to make sure renal perfusion is there, so it will help to flush the infection. Um, what about monitor for preterm labor? What about D, guys? A, B, C, D, F? Yes, okay, preterm labor definitely, because patient is always at high risk of preterm labor, because we are having the inflammatory response, and that's why we need to monitor for that. Avoid all antibiotic in second trimester. Is all antibiotic tetragenic or some of them? No. Yeah, because there are some medications that are safe to use. There are some medications safe to use, like penicillins, cephalosporins. Those medications are safe to use. Okay. And what about F, fetal monitoring as indicated? What about F, guys? F, yes. F is yes. Okay, we need to make sure, like, if infection is putting any impact on fetus, so we can work on that, especially like fetal heart rate is very important. Okay, so 31 is correct. Let's move to 32. A patient with rhabdomyolysis is admitted after crush injury. Which actions are priority to prevent AKI? Select all that apply. So we are having rhabdo here, and we need to prevent AKI, and we have crush injury. So these are the three keywords we have. And we know rhabdomyolysis is breakdown of muscle tissues. So there is more myoglobin into the bloodstream, and that can be toxic to kidney. Okay, that's why we have AKI. What about rapid isotonic fluid resuscitation? What about A, guys? Yes. Okay, we need rapid, because the thing is that we want to flush down those myoglobin out, so that's why we want to flush those down. Alright, what about B, monitor urine output hourly? What about B? Yes to B. Yeah, because like if there is oliguria, that is gonna be sign of kidney disease. Okay, kidney is failing right now, so if we have oliguria, kidney is failing, so we need to monitor. Alkaline urine if order. So alkalines urine, are we gonna alkaline the urine with sodium bicarbonate? Because we can give the sodium bicarbonate that can prevent the accumulation of myoglobin into the, yeah, if ordered, always correct. Okay, so C is correct. What about avoid folic catheter to prevent infection? D. Are we gonna increase the urine output, or are we gonna decrease the, because folic catheter definitely gonna help us to increase the urine output? Yeah. Okay, so that's why we actually need it. Okay, so it's often necessary, and you also need to monitor. Yes, JJ, you also need to monitor. Okay, that will be helpful to monitor the urine output. And what about monitor potassium and CK level? If high level of CK and hyperkalemia, it can tell us whether there is a higher kidney damage. So we need to always monitor these one. What about restrict fluid until CK normalize? What about F? Yeah, no, because we are actually giving the resuscitation, we are giving the rapid one. Okay, so we don't want to restrict the fluid, so definitely This is the way. Question number 33. So the nurse evaluate teaching about erythropoietin for CKD anemia. Which statement show understanding? Select all that apply. Thank you, Betty. Guys, please go and subscribe Nursingy on YouTube also. We have all the old lives posted there. You can see all the old live on YouTube. If you miss any, please go to Nursingy at YouTube. Okay, my hemoglobin shouldn't go above the target. What is erythropoietin? Because we have erythropoietin stimulating agents, ESAs, and that we need to give because now kidney is not producing enough erythropoietins. So what about A? Correct. Actually, it is correct. Okay, we wanna maintain the level. We don't wanna increase it too much. Okay, so we have to maintain the level. If we are giving too much erythropoietin and then its bone marrows are producing too much, red blood cell, it can be increase the viscosity of the blood. That can cause stroke. That can cause MI. Yeah, so we need to work on A. What about B? I may need iron supplementation. You are giving erythropoietin to person, but there is not enough iron in the body. So what's gonna happen? That's not gonna produce enough blood. Okay, so we need erythropoietin also. We need enough iron also. What about C? It's not the immediate energy today. Does erythropoietin start working immediately, or does it take time? Take time? It is actually correct, okay? C is correct. So this is gonna take time. So if we are, yeah, okay. So that's why it is correct. Yeah, when it takes time, it can take like weeks, it can take even month to make hemoglobin level raise. Okay, it can increase my blood pressure. We just discussed that. Can it increase? It is one of the common side effect and serious side effect of EPAs. Okay, ESAs. Sorry. So it can increase the blood pressure. What about E? I will take it only when I feel tired. So erythropoietin is scheduled medication, regular medication, or is it energy medication? Incorrect. Yeah. So it's not a PRN kind of medication. Okay. We need to keep it ongoing. What about F? It reduce my need for dialysis. What about F, guys? F no? Yeah. Okay. Erythropoietin is not gonna help to improve the kidney function, or it's not gonna improve like that patient doesn't need to go for dialysis. It's just gonna help with producing blood. Okay, so patients still need dialysis if they are on dialysis. Okay, thank you, no BNG. Alrighty, let's move to question number 34. We only have 16 questions left. Next week we are gonna do all electrolytes, and this week all the videos about electrolytes are gonna posted on YouTube. So make sure you guys keep learning from those videos, and next week we will do some electrolytes MCQ or SATA. Topic for tomorrow. Tomorrow is GI tract, gastrointestinal. The nurse assess for urosepsis in an older adults with UTI. Which finding are concerning? Select all that apply. Come on, guys. Let's do it. New, yes, yes. Okay, let's do this. So we are having urosepsis in old adult with UTI. Okay, what is concerning? A, yes, so our normal time on live stream is 10 p.m. New York time. That's gonna be all our normal time, except some Fridays. Except some Fridays, okay? I will keep you guys updated when we are not coming live on that time. Rest of the time, it will be always 10 p.m. New York time. Okay, new confusion, always new. Okay, every time when in NCLEX, if you are getting new, especially in confusion, it's always concerning. Regardless, it's related to the problem or not, always concerning. Okay, hypotension. Can UTI cause hypotension? Yes. Okay, because what can be happening? We are having hypovolemic shock. Yeah, low blood pressure. It is key sign of hypovolemic shock. Tachypnea, compensatory mechanism now going on. There is less hypoxia. We are having hypoxemia, so that's why respiration is increased. So yeah. What about bradycardia, guys? Are we gonna see tachycardia or bradycardia? What about D? Tachy. Okay, we're gonna see tachy. Even this is very hard to see the stable BP in urosepsis. Okay, you are having shock. There will be hypotension. There will be tachypnea, and there will be tachycardia. What about lactate elevation? What is lactate? Why we have lactate? Why we need to look for lactate, guys? It's an enzyme, yes. Okay, especially when we having the septic shock, it is expected, it is definitely expected, but it will be the marker of anaerobic metabolism. Okay, when we don't have enough oxygen, and poor tissue perfusion. When we don't have enough oxygen, the muscles and tissue will start break down, and that's how it produce lactate, and that's why you will have lactate elevation. Okay, what about F? Afebrile but ill appearing. Can it be the case when patient can be? Yes. Okay, F is definitely yes, especially in the older adults, because they may not have the fever response. Okay, they can still be septic and they can have septic shock, but it doesn't need to be febrile all the time. So always watch for other vital signs also. Most of the time you will get is tachypnea. Change in respiration is our first thing to see. Okay, if there is a change in respiration, then you can correlate everything else together. Thank you, guys. Keep double tapping. Let's move to question number 35. We will do 6 more questions and then we'll have another break. The nurse provides discharge instruction after kidney biopsy. Hi, John. Which are appropriate? Select all that apply. Question number 35. So, kidney biopsy, because we need to take in our tissue sample. So, there are risk of. Can you explain febrile, afebrile? Febrile, that is having fever. Afebrile, there is no rise in temperature. Temperature is normal. Okay. Lie on affected side for several hours post procedure. What about A? What about A, guys? No, actually A is yes. Okay, actually A is yes. To stop the bleeding, what you guys do? Because this is the thing. Okay, so we are just had kidney biopsy, and we are giving the discharge instruction. And for kidney biopsy, you need to make a cut. Okay, you need to put pressure to stop that bleeding. Yes. Okay, so that's why A is correct, guys. What about B? Avoid strenuous activity for 1 2 week. What about B? Because if you are doing the strenuous activity, it's gonna increase the hypertension, and when we are gonna have the hypertension, it's gonna increase the pressure on the kidney, and there is higher chances of bleeding. Okay, so B is correct. We need to make it fully healed before we will do any hard and pressurized exercise. Expect mild hematuria initially, and this is the keyword again. It is mild and it is initially only. Okay, so no, definitely. Oh yes, yes to see. Okay, because we're gonna expect that one. And D, stop anticoagulants without consulting the provider. Oh my god, don't do anything without consulting the provider. Okay, that's always wrong. Report flank pain, dizziness, or heavy hematuria. Option E. Yeah, because now what's happening? We are having heavy hematuria. There is internal bleeding going on, and that's why flank pain is there. We are having dizziness because of hypotension. Kidney is losing too much blood. Hypotension, not enough oxygen going to the brain. Okay, so that's why we are having E. So we need to report these concern. F, increase fluid intake if not contraindicated. And this is another thing, keyword for NCLEX also. Okay, if not contraindicated, usually when it is highlighted, when it is there, it's always yes. Okay, because if it is contraindicated, then we will not give it. So that's why we are happy with that. So we will do that. Okay, let's move to question number 36. A patient with urinary retention is prescribed Bethanacols. So which assessment considerations are important? Select all that apply. What about... So Bethanacol, we know it is cholinergic medication. Yeah. What was the last one? Last one was correct. We can increase the fluid intake if not contraindicated. Okay. And guys, these questions are gonna uploaded on YouTube also. So make sure you subscribe YouTube. All our lives are on YouTube. Okay, assess for bowel obstruction before giving medication. We know it is cholinergic medication, cholinergic agent. It can stimulate the bladder contraction, which help for the like urinary retention, but it also affect the GI motility. Okay, so it can increase. So if we are giving the medication and it's gonna increase the yeah, it can cause the perforation. There are too much contraction, GI contractions going on, motility is increased, bowel obstruction is there. There gonna be perforation. So A is good. B, monitor for bradycardia. Yes. Cholinergic, parasympathetic. Yes. Okay, and we know parasympathetic do rest and digest. Yeah, so always slow down everything, and then we gonna watch for bradycardia. Okay, withhold if urinary obstruction suspected. C, same thing. Okay, the same rationale we give to bowel obstruction, same we are gonna do here. If there is a urinary obstruction, it's gonna cause too much contraction of the urinary bladder. It will stimulate the bladder, but then obstruction gonna cause rupture of bladder. Okay. D, monitor for bronchospasm in asthma. Can we give cholinergic medication in asthma? Okay, we're gonna monitor this one because otherwise it's gonna cause bronchoconstriction. Okay, so especially in asthma, please be careful. We need to know what we are giving to the patient. Expect urinary retention to worsen. Is this medication is gonna help urinary retention or gonna increase urinary retention? D, no. E, no. Yes. Okay, this is gonna help to improve, not to increase. So E is no. This is why this we are giving this medication. And evaluate ability to void after dosing. Why we evaluate? F, yes. Keep double tapping, guys. Why we evaluate? Because we want to see the effectiveness of that medication. Okay, so definitely we're gonna evaluate. Yeah. Okay, question number 37. The nurse notes a new order for gentamicin in a patient with reduced renal function. Okay, this is very um, typical aminoglycoside antibiotic that can be very nephrotoxic and ototoxic and have very narrow therapeutic range. So we have reduced renal function already and we are giving gentamicin. Okay, which actions are appropriate? Select all that apply. Come on, guys. Do we need to watch for baseline creatinine and EGFR? Just to A? Definitely, because these two tests are gonna tell us like how much kidney is working and what is the capability of renal function over there. So that's why yes to A. Monitor TRO level. And same thing with B, because we say like this medication can lead to toxicity easily, and that's why we need to monitor the TRO level. Okay, encourage high protein diet to protect kidney. Why we need C? Do we need to encourage or do we need to make it constant? C, no. Okay, because it's not a treatment. If we are giving too much protein, it's gonna damage kidney. Okay, so yeah, assess for ototoxicity. Constant. Yeah, always constant is right answer. Okay, yeah, and this is one of the medication because aminoglycosides mostly common for ototoxicity, so we need to make sure like we are checking. Okay, what about report decreased urine output? What about E, guys? We done this one. So now there is too much accumulation of gentamicin in the body, and that's why we are having acute kidney injury. And when we are seeing acute kidney injury, there will be the oligouric phase. Okay, so then we will see less urine output, so we need to report that one. Avoid concurrent nephrotoxin if possible. So are we gonna give another medication that can damage the kidney alongside this medication or no? If yes, yes. Okay, we're gonna avoid, because otherwise there will be the double effect and it's gonna cause more damage to the kidney. Alrighty, 3 more questions, then we will have a break. 38. The nurse is teaching a patient about prevention of calcium oxalate stone. Which advice is correct? Select all that apply. So calcium oxalate, as we know, is most common stone. Okay, most common type of stone is calcium oxalate. Okay, so usually we need the dietary consideration change, like how person is eating and drinking. So that's okay. Increase fluid intake to produce more than 2 liter urine per day. Definitely. Yes, JJ, definitely. Okay. Because this is the most common way. If somebody is having low hypovolemia, kidney function are reduced, then there is more status of the function and fluid in the kidney, and that's why there is more chances of stone formation. So if it keep flowing out, it's good. Limit sodium intake. What will happen if we are limiting the sodium intake? B, no. Actually, B is yes, yes. Okay, because when you will have less sodium, then there are less fluid retention. Yeah, limited sodium, less fluid retention, and that's why body will excrete more. Okay, so that's why that's our goal, like excrete more. C, um, moderate dietary calcium, don't eliminate. C. Yeah, there is it. C, yes, yes, C is correct. Okay, so this is saying moderate. Okay, this is the keyword again. This is not saying reduce, this is not saying increase. Okay, so when if we will eliminate the calcium, it's gonna be counterproductive. Okay, because then there will be more oxalate absorption in the kidney, and then you will have more stones. Alrighty, so always be consistent, always be moderate. Yeah. What about restrict high oxalate food? Is D correct? So high oxalate food like such as nuts and spinach can be the one. Yeah. Okay, because we don't want the accumulation of oxalate, so that's why we need to restrict it. Okay, so D is correct also. And what about E? What about E, guys? High animal protein diet is recommended. What's gonna happen if we are having high animal protein intake? E is yes, dry fruit nut. Yeah, E no. Yeah, E is no. Okay, because they have urinary. They can increase the uric acid. They can increase the because there are more protein, and yeah, there are more protein. There are more uric acid, so there are higher chances of stone formation. So we are not gonna recommend that one. And what about thiazide diuretic? Sorry, I'm a bit feeling like on the top of my lungs today. Thiazide diuretic. Yeah, okay, because we know thiazide diuretic is important. We wanna give it. Yeah, we wanna give it. Yes, help to pass the stone, and it also reduce the calcium excretion in the urine. Reabsorb calcium. Yes, Nico. Alrighty, let's move to question number 39. We have two more questions before the break, and then everyone need to go to YouTube and subscribe Nursingy. If we will have everyone subscribing, that's the deal. We will do another 10 question. A hemodialysis patient return from treatment, which finding are common and expected? So common and expected. Okay. Fatigue, hemodialysis. Will patient have fatigue? Tiffany, all the questions are available to buy. All the studies guide are available to buy. But if you don't want to buy, you can go to YouTube. All these videos are getting uploaded there. Okay. You can listen to the rationales. 39, guys. Because now we have a lot of electrolyte imbalance, so that's why fatigue is very common. Okay, what about hypotension? What happen in hemodialysis? Because there is rapid fluid removal, so that's why there can be sudden hypotension also. Okay, and what about high headache? Same thing. Change in blood pressure, change in fluid intake, change in fluid shift. Yes, headache is common. And what about oozing from excess site requiring pressure? Is oozing common and expected? No. Okay, so D is no. D is definitely no. We want it dry. We want it like oozing is not expected. We need to make sure it's bended and dry. What about hyperkalemia? Can we see hyperkalemia or can we see hypokalemia? Thank you, Tasha. Thank you guys for keep double tapping and following. Really appreciate. Hypo. Okay, so that is one of the reason we do hemodialysis to reduce that one. Okay, so it prevent the hyperkalemia. We don't want to see hyperkalemia. We actually want to see it at lower level, not even hypo, because hypo can also cause dysarrhythmias. So we want to see between like normal but on the lower level. Okay, so hyperkalemia is incorrect. Yeah, yeah. Weight decrease. Weight decrease. So what's gonna happen when we are removing the fluid? We are gonna reduce the weight also. Okay, so fluid, 1 liter fluid is equal to 1 kg. That's usually they say. So it depends how much fluid we are removing from the body. So there will be some weight reduction. Okay, question number 40, and that's our last question before the break. Yes, yes, weight before and after, because particularly it will let us know like what we have done, and it will be helpful to assess the situation. Okay, now we got the nurse care for patient with post renal AKI. Okay, what kind of post-renal AKI we can see? What can be the common cause? What data support this? Select all data apply. What is the most YouTube? If you will just search Nursingi user, if you will search Nursingi on YouTube, you will see same logo. Okay. Otherwise, link is in my bio for all of our social media account. Link is in bio. If you will click the link tree, you will see all the social media links. Okay, guys, what is the common cause of post-renal AKI? Most common. Anyone? Is the BC AC? Okay, stones. Thank you, Nico. Yes, obstruction. Alright, it can be due to anything, but mostly it is stone. And then when we have backup of pressure, it can cause the kidney injury. Okay, what about suprapubic fullness? Are we gonna see that one? Because now we have the obstruction. UTI is not that common, but it can cause. Okay, it can cause. Yeah, it can definitely cause in the severe cases when it goes up toward the stream and then infect the kidney. So suprapubic fullness, because there is a obstruction, and then retention of urine. Okay, that's gonna affect the kidney. Hydronephrosis on ultrasound. Are we gonna see swelling of kidney? AKI is acute kidney injury. Okay, and this one is the one of the common cause, sudden injury. Yes, okay, because now there is too much fluid accumulation in kidney, and that's gonna make it swell. So when there is a swelling, you're gonna see hydronephrosis. Okay, so B is correct. What about C, BPH with urinary retention? Can we see prostatic hyperplasia? Same thing again. We discussed about that just to see, because if you are having prostate hyperplasia, what's that gonna do? That's gonna put the pressure on the ureters, and that's not gonna let urine flow properly, and blocking the urine can cause the injury. Yeah. And what about severe dehydration? Is it gonna cause Yes, Nico, definitely. Thank you. It's pre-renal, okay? It's not post-renal. Yeah. So anything before, anything from systematic circulation, pre-renal. What about bilateral urethral obstruction? So most common is like we have kidney stone in both urethra. Yeah. Yes. Okay. And it's gonna damage both of our kidneys. um what we say, wouldn't be intrinsic to technically, um yeah, but like we can see this because this can be the data, this can be the reason. So yeah, ace inhibitor overdose, what will be